So this COVID pandemic also brings to mind that we need to kind of prepare ourselves to perform research, and then the question is what research areas are really important. So one of the things that the Comprehensive Cancer Centers of Cancer Core Europe have tried to do is to define 4 areas of research. Obviously, the first one is to really have real-world data. For now, we always have been adding treatment opportunities for patients to existing treatment. What you have seen over the past couple of months is that people now actually de-escalate treatments, but we need to find out whether that's safe, so we need to collect the real-life data. Then the second area is to see how cancer patients have responded to the COVID-19. Many people have thought that chemotherapy or immunotherapy could have an impact on how our immune system would respond to the virus. So I think that large-scale serological testing for antibodies against COVID-19 would be really important to understand whether cancer patients have a less immune response compared to the overall populations, or whether they have an even stronger immune response. Then, obviously, if for the future we run into another pandemic, we also need to have like epidemiological models on how we can understand how the spread and the cumulative incidence of COVID-19 for patients with cancer happens in a certain time frame. And then finally, I would say that it's very important to see how COVID-19 as a virus has impacted the outcome of our cancer patients who were treated with chemotherapy, with targeted therapy, with checkpoint inhibitors. And I would say that there are several projects now underway in the countries and also Cancer Core Europe. So having said that, by starting collecting that information as soon as possible, we will be able to create some more insight. But I also need to kind of say that that will take time. I would say in general, the best thing for the next wave is to make sure that we have the capacity in the hospitals on the intensive care units. If you have an added capacity for ICUs, I'm convinced that we can continue with our cancer care at the highest quality as we have done so far.